Now we want to add the Chf Pathway Column. How do we do that? It's really simple. You're just going to highlight your patient list. You're going to go to More, Edit List, then Properties. We're going to search for Chf Pathway. And then you'll see it right over here. We're going to highlight it, add it, and it should be at the end of our list down here. Now to make this permanent, we're going to press Accept, and then you'll see the Chf Pathway Column right over here. Now that we have the Chf Pathway Column, you note that there's going to be dots in the column. Now what do these dots mean? Now if you see a green dot, that means that the patient is on the Chf pathway. If you see a red dot, that means that the Chf pathway is recommended, but the patient has not been ordered for the Chf pathway. So please ask the doctor to put them on the pathway. Now let's say you have a patient and you know that they have a history of CHF. Please also ask the doctor to put them on the pathway. Another great way to know if your patient is on the pathway is by simply going to the Summary tab. If you see this pink banner, then you know your patient is on the pathway. When we have a patient on the CHF pathway, please make sure to consult social work and nutrition. By consulting social work, we're involving VNS, visiting nurse services. They'll help monitor our patient at home. When consulting nutrition, that just ensures that our patient is educated on the proper diet for CHF. To document our education, we first need to do the assessment. How do we do that? We're going to press in the Education tab, then the Assessment tab, and then Create New. We'll complete this assessment, and once we're done, we just press File. Now, how do we specifically document on CHF? Well, the first thing is we need to get CHF in this column. How do we do that? We're going to press on Education, then Education again, and then we're going to press Add Title. Now we're going to search for CHF. We're going to highlight it. And now to select all this education, we're going to press on this box. And then we're going to press Accept. And by doing that, you'll see CHF right over here. Now to document it, you simply click on this box, and then you press Document. And then this box will pop up, and you simply just fill out the box. Now in this comments section, please make sure to document the topics that you discussed, the educational materials that you gave, and the self-monitoring tools that you provided to the patient. For your CHF patient, please make sure to do the following care plan: altered cardiac output. To document the weight, it's really easy. You just have to go to the vital signs flow sheet, and within that flow sheet, you'll see the height and weight flow sheet. And you're going to document the weight right over here. Please make sure that the weight is documented in kilograms. You can enter it in pounds, and Epic will convert it, but just make sure it converts to kilograms. Also note to document the method that you got the weight, whether you're using a standing scale or you're going to use the bed. And please make sure to never document a weight that was reported to you or estimated. When taking the weight, please make sure to use the same scale, the same amount of clothing, and to do the weight at the same time, which will always be before breakfast. And you could use this card over here to kind of guide you. When documenting your intake and output, there are just some things I want to note. Please make sure to document 0 if your patient had nothing to drink or had no urinary output. Leaving it blank is not correct. Document the output amount in the correct source. So let's say the patient had emesis. You document the output for the emesis right over here. If the patient has a Foley, you would document the output right over here. And here's a useful badge card to help you remember how many mLs are, for example, in a small soda can, which would be 240 mLs, or in a white styrofoam cup, 240 mLs. This will help you calculate your intake and output during your shift.